cancer and you need surgery. The marks the procedure might leave behind are not your first concern.
I knew whether it was cancer or not, I wanted it removed.
Now, obviously, saving your life comes first if you're dealing with cancer, but for a highly visible area like the neck, why not avoid a scar if you can?
Our medical expert, Dr. Frank McGeorge, joins us now with a breakthrough cancer surgery that does just that.
Lumps in the thyroid gland located here in your neck are fairly common, but it's often hard to tell if they might be cancer, leaving at least partial removal of the gland one of the only options. And if you scar badly, the results can be less than ideal. But for the right patients, there is an alternative.
Hi, how are you doing?
It was 8 years ago that Michelle Livingston of Woodhaven first had a thyroid problem.
I discovered it just while doing some ordinary work around the house and then drinking some orange juice, and I happened to notice that there was a lump on my neck.
And back then, there weren't many options.
The option was simply to go in, have it removed by cutting me along the neckline, and the hope was, of course, that it would heal and that it wouldn't present too much of an ugly scar.
Dr. Ho-Sheng Lin is a specialist in head and neck cancers at Karmanos Cancer Center in Detroit.
Thyroid surgery has not really changed that much in the span of the last 40 or 50 years.
Michelle had the left half of her thyroid removed, and the scar healed well, but
anytime you have any surgery or cut, you kind of tend to think that, you know, it's just this flag hanging out there for the world to see.
Michelle thought it was all behind her. Then last year,
I went in for just a routine examination, and during that routine exam, there was the discovery of a small nodule on the right side of my neck.
Having been through this 8 years before, she knew what to expect. A sample of the lump was taken with a needle called a fine needle aspiration.
Following the fine needle aspiration, the results were inconclusive. There was no way of knowing one way or the other whether there was cancer.
And
because I had had the surgery done prior to this, using the incision along the neckline, I was more concerned with having a second incision in the same place.
So Dr. Lin offered her a brand new option, only developed in the last few years.
The goal is to avoid any scar at all in the neck area. And so all this can be approached through the armpit, in which you can go through here to get to all the neck area.
Getting from the armpit to the thyroid gland in the neck is no easy task. The surgeon has to make a small tunnel from here to here under the skin. And the only way to work in the neck through this tunnel is by using these tiny robotic hands under the control of the surgeon.
I was pretty awestruck by the possibility of a robot just being part of this whole surgical procedure.
But Dr. Lin cautions.
This is not the surgery that's suitable for everybody. There's patients who really we don't know if it's cancer or not, but we just need to rule it out.
It's also well suited for thinner patients and those with dark skin who are prone to developing a darker scar or keloid. For patients like Michelle,
when the surgery was over, it was thyroid was gone as well as the cancer. I have a job that I'm quite visible in, and the scar was a factor for me. And I don't have to worry about that, and nobody's looking under my armpit. You know, I kind of look at it like cancer kissed me hello and goodbye all in the same day.
Now, it's important to point out the primary reason to remove a thyroid with this procedure is to avoid a neck scar. Recovery times are similar to the traditional surgery, as are complication rates. Back to you.
It's like every day there's another miracle in medical technology. Well, there's a lot of excitement going on at Karmanos. One of the big events that helps fund cancer innovations is the Karmanos Cancer Institute's 31st annual dinner, and that's coming up on April 20th.
General Motors is a major sponsor of that event, and our very own Ruth Spencer will be there as the MC. For more information or to buy tickets, just check out the health page at clickondetroit.com.